the 2008 International AIDS Conference, brought to you by KaiserNetwork.org.
At the 17th International AIDS Conference in Mexico City, more than 25,000 scientists, advocates, as well as community and political leaders gathered under the theme of Universal Action Now. UN AIDS Executive Director Peter Piot set the stage, pointing to encouraging successes in the battle against the disease.
For the first time, fewer people are dying of AIDS, and for the first time, fewer people are becoming infected with HIV. For the first time, we have empirical evidence that our brilliant coalition can move mountains. A unique and diverse coalition present here in this auditorium. This is cause for great encouragement. But it's not cause for complacency, and it's certainly far too early for declaring victory.
Alex Coutinho, Executive Director of the Infectious Diseases Institute in Kampala, Uganda, agreed that there are still many challenges ahead.
We should not accept that less than 10% of individuals at high risk for HIV, like sex workers, IDU, MSM, and prisoners in developing countries, are receiving appropriate prevention interventions. We should not accept that PMTCT, a proven effective preventive technology, is not the highest of global and national priorities to reduce HIV transmission to children to below 2%. We should not accept that proven methods of HIV prevention, like male circumcision, are yet to be deployed in most countries that need them, including those where the research was carried out. We should not accept that we cannot provide HIV testing routinely to all who need it.
Add to the list a shortage of healthcare workers and health systems in disrepair faced by many of the countries overburdened with the epidemic. Former U.S. President Bill Clinton.
In some African nations, nearly 3 in 4 people who have TB are also infected with HIV. It doesn't make much sense for us to continue to be asking these men, women, and children to go to 2 clinics with 2 doctors and 2 pharmacies and 2 strategies to treat one person who has got enough problems as it is. We must do more to decentralize the delivery of all kinds of quality health care.
Julio Frank, the former health minister of Mexico and now with the Bill and Melinda Gates Foundation, described how his country incorporated HIV/AIDS into its overall health reform efforts.
Is that health care cannot be seen as a commodity or a privilege, but as a social right. In the case of AIDS, this meant not only assuring universal coverage, but also launching an open battle to fight stigma, violence against women, and homophobia. To this effect, Mexico amended its constitution and passed laws to prevent and punish any type of discrimination.
Just in the past few years, treatment scale-up has been dramatic, now with more than 3 million people on antiretroviral drugs.
I'd like to show you the photograph, the image of Avalile at the age of 7, weighing less than a 1-year-old baby, suffering from full-blown AIDS.
Singer-songwriter Annie Lennox advocated increasing access to treatment, especially for women and children.
And 5 months later, when we went to see her, and she'd received decent medical care, loving care, decent nutrition, and treatment, that's the same child. So if the photographers would like to come and take this picture, this is a huge symbol of the kind of positive changes that can be made. This is the positive message that can come out of the African AIDS pandemic, with access to treatment, good nutrition, decent medical health care. This is what surely we would all like to see.
While getting treatment to markedly more patients remains a key pillar in the HIV/AIDS strategy, prevention efforts must keep pace, according to Jaime Sepulveda, Director of Integrated Health Solutions Development in the Global Health Program at the Bill and Melinda Gates Foundation.
For every 5 people who become infected, 3 will die without ever accessing treatment. I would suggest to you that one way of knowing that we have turned the corner is to look for the day when more people are started on therapy than are newly infected with HIV.
Also today, leaders from the U.S. Black community called for a domestic response equal to that their government has given overseas. This after a report from the Black AIDS Institute found some similarities in severity between the AIDS epidemic in Black America and many countries served by the U.S. Global AIDS Initiative. U.S. Congresswoman Barbara Lee.
So where is our PEPFAR for the United States? We need a domestic AIDS response that brings new resources to an effort that has been virtually flat funded for years. We need a domestic AIDS response that is oriented around achieving clear and ambitious objectives in terms of reducing HIV infection rates, increasing access to care, and reducing racial and ethnic health disparities.
In Mexico City, I'm Jill Braden-Balderas with KaiserNetwork.org.